everyone. Welcome. This is Kristen Alexander from R0, and we're going to be getting started in a few minutes to walk through an outline of the Tennessee grant that's just being issued for infection prevention in long-term care facilities. So I think I'll wait, a minute or two to let people join. And then we'll get started. I'm just going to also pull up the slides that we're going to review today. All right, let's kick this off. So thank you everyone for joining. Again, I'm Kristen Alexander from R0 and wanted to just casually have a conversation on the Tennessee grant that's being issued for long-term care facilities in the state of Tennessee. This is for infection prevention, resources, and support. So today what we're going to do is talk through what the grant is and some of the key parameters that we're working towards this week to hit the application deadline. Why UVC is a great option for infection prevention, and particularly why now, considering the CDC and ASHRAE guidelines that have been released this year. And then we'll talk more specifically about R0's solution, our specific devices and what they might offer a senior care facility, what our customers use and their success. And then we'll follow up with some resources. This webinar is being recorded. We'll send the link following the webinar so you have access to it and can share it around. Great, so let's talk about the grant itself. So the state of Tennessee Department of Health created a request for application, which is called the Long-Term Care Facilities Reimbursement of Infection Prevention Resources and Support. And it has a request for application number that I'm just noting here for your reference later. This funding is to assist long-term care facilities, and it does include assisted living, which is a popular FAQ. We've had a lot of questions around that. And it assists with infection prevention measures needed for preparedness during any outbreak. They use COVID as an example, but it could be any outbreak that you're preparing for. The grant will be awarded for purchases. There's a list in the grant application of the types of purchases you can make. One of them is supplies, which includes UV disinfecting devices. And so we've called that out, the specific language out for you here so you can see that. The application deadline is this Friday, August 25th at 2 p.m. Central Time. So we're working with our customers and prospects to take advantage of this grant before that timeline. You'll see on the Tennessee, State of Tennessee website, which is just tn.gov, they have a bunch of supporting materials there. The specific URL is tn.gov/health/funding-opportunities. And we'll send that URL as well as a follow-up resource. You'll see here is the grant and all of the resources that the state of Tennessee provides to take advantage of this grant opportunity. They have the original request for application, the application itself, which you can download here and then upload as part of your submission process. They also have an amendment, and the amendment has the specific timeline and also a link to the webinar that the state of Tennessee put together to talk about the grant application process as well. Here's the timeline that's in that amendment. I just wanted to share it for you. So basically, this is where they highlight the deadline for applications, which is again 2 o'clock Central Time this Friday. And then this timeline also shares when you would expect to be notified that, and then also, when it's expected you could get started and how much grant funding would be awarded. So it's a pretty quick turnaround from when they started this grant to now. I'm including a few helpful resources so you'll have access to this. It's the original request for application, the amendment, a link to the webinar, and then there are two forms that need to be filled out as part of the application. The first is the application submission. You need to include the facility name, address, the person who is signing on behalf of the facility, the EIN for that facility, and whether or not you are a vendor in the state of Tennessee. If you're not yet a vendor in the state of Tennessee, it's okay, you can still apply for the grant. But if you are awarded a grant amount for reimbursement, then before you can receive that reimbursement, you must register to become a vendor in the state of Tennessee. Our understanding is that process takes a few months. Still worth applying because you could use the funding from the state of Tennessee to fund a program. And we can follow up with you on that process and how to do that. The Tennessee.gov website does outline the steps to take to become a vendor, if not already. And then there are also there's also a document called competitive requirements that needs to be filled out. These are pretty seamless forms to fill out, and we're happy to help any prospect in completing these, which we've been assisting with as we go. Okay, that's the section on the grant itself. Please, if you have any questions, feel free to ask them in the chat, and I'll find a break and answer those questions as you have them. So why is this important now? Obviously, effective disinfection improves outcomes in healthcare settings, and we see a number of outcomes tied to creating a healthy indoor environment for your staff and your residents to thrive. UVC is a great solution for disinfection because of its efficacy. So 99.99% of all pathogens are inactivated with UVC, and we have devices that work for airborne illness as well as surfaces, and we'll talk a little bit about what those pathogens are and the efficacy of UVC. Another benefit to your business is that by inactivating these pathogens, you are dropping the risk of facility-acquired infections, which is material to you from a monetary perspective and avoiding penalties, but also creates great outcomes for your residents, which improves patient satisfaction, facility ratings, and also creates great outcomes for staff, improving staff shortages, where staff will choose where to work based on the safety of their environment, and this is certainly a contributing factor. Something we're really proud of in our approach to disinfection in the market is that we are a highly sustainable solution. So, with other solutions that help contribute to creating a healthy indoor environment, so HVAC as an example, and creating air changes per hour, with UVC disinfection, we're also able to create a high level of air changes per hour, but much more sustainably, running on only the power of a laptop and emitting 95% less greenhouse gas emissions. We have no chemical byproducts or waste, and so really being a climate-friendly solution is the way of the future. And we also are democratizing access to our platform. We've really lowered the cost significantly of our devices so that the most facilities can be protected and offer healthy indoor environments. We're constantly looking at how we can decrease the cost and therefore offer the most affordable pricing to our customers. So let's talk about why is this such a topic right now. Two trends to be aware of. ASHRAE, the governing body that controls building codes, came out with a new standard in July that recommends effective air changes per hour by room type. So based on the risk in the room, the occupancy level, how many air changes per hour create a healthy indoor environment. Specifically, there's a trigger for high risk times. So facilities and organizations will be required to abide by these standards in a time that's determined as high risk. If there is an outbreak, for example, in a specific geography, and an authority says that this is a time of outbreak, then facilities will be required to abide by those regulations. So that's one big trend that's affecting why this is becoming top of mind today. And also the CDC has recommended that across the board, every type of facility and organization with an indoor environment maintains a level of at least 5 air changes or effective air changes per hour. And the CDC also specifically calls out upper room germicidal UV as a very effective method for providing that level of air changes per hour in any indoor environment, and essentially a healthy indoor environment. So those are 2 trends impacting why now. We put together a chart to just show the difference. So in the current standards by vertical, and so we'll talk about healthcare specifically, there was guidance around how many air changes per hour you would need by room type in an exam room or patient room or waiting room, for example. And with the new ASHRAE standard, which is called 241, the standard is 241, you can see the level of increase in exam rooms, 6 times the effective air changes per hour in patient rooms and in waiting rooms. So really providing a level of disinfection so that it's safe to interact and be next to people and not spread infectious disease is the goal of these standards. There are a number of options to comply with requirements, and we think of UVC as operating in concert with and collaboration with what you may have as a program today. So of course, every facility is going to have an HVAC system. This is helpful in terms of creating air changes per hour in any room. It's certainly, HVAC is designed for comfort, so of our residents, which is material. But in terms of reaching the limits that are set forth in the ASHRAE guidelines, it's very hard to do that with HVAC alone. It's not sustainable. There is a lot of energy used from doing that, and it's nearly impossible to run your system at the level you would need to achieve these guidelines. So UVC helps support the work that HVAC is doing. Portable air filters really don't add the level of air changes per hour you would need in a room, and they are most often loud, and the larger they are, the more effective they are and the noisier they are. So in a resident environment, it's often not the best solution for the risk that exists in this type of environment. In-room UVC is a great option because you can create a significant achievement in terms of air changes per hour, particularly with upper room UV. And I'll talk about each of the devices. And so UVC has been used by hospitals for decades for this reason, because it's highly effective. And just now we're seeing the spread to senior care facilities, long-term care facilities, and other verticals like schools and corporate environments as well. How this impacts, why a facility would choose to select a UVC program as part of their overall standard of disinfection. Certainly, it reduces facility-acquired infection risk, which helps improve census. It helps decrease readmission rate to hospitals, and also, improves patient satisfaction and facility rating. So these are all, quantifiable benefits associated with adopting and running a UVC-based program. It also helps you avoid the cost of manual disinfection, which is twofold. It's, both it's using a chemicals and the cost of those chemicals. It's also the work and the labor that goes into that, and also the byproducts of chemical disinfection, which we help avoid. Of course, there will be some chemical disinfection that you use. UVC can supplant some of that. Also helps you with your energy cost savings by not requiring you to turn up your HVAC systems, which some facilities do in an attempt to create those air changes per hour. That is not a great use of that technology. And then, of course, helps you avoid CMP fines as well. So those are some quantifiable benefits for why you would move forward with this type of program. We have a couple of large senior care facility customers that we're proud to work with and support. We have other resources where these customers have shared their success stories that we're happy to share with you. One example is Trilogy Health Services, which is 127 facilities, senior care and skilled nursing organization. They operate in a few states, and they support 9,000 residents and 12,000 employees. And they're using our UVC devices in concert with each other, ARCs, beams, and Vives. And they demonstrated through their study what they were able to achieve in terms of reducing airborne pathogens and surface pathogens as well. We have detailed case studies like this from our customers that we're happy to share with you for your opportunity to review and see if this might also be something that helps you improve outcomes in your facility. Talking through our solutions specifically, something that's unique about our approach is all of our devices are data enabled and connected. So what this allows us to do is help you understand where risk lives in your environment in real time. We can also help you understand the adherence to your janitorial workflow. So if you have a workflow where you have an expectation, for example, rooms are cleaned on a specific schedule, bathrooms are cleaned on a specific schedule, shared common areas like dining spaces, rec rooms, exercise rooms, or physical therapy rooms are cleaned on a specific schedule, we can demonstrate and give you the analytics to show adherence to that schedule. So every single device has a sensor where it's capturing information about your occupancy data, your environmental data, as well as UVC dosage, so we can determine if disinfection has occurred, and that's what helps us provide that adherence information to you. So that's a real benefit because you can now have a pulse on which rooms in your facility have been cleaned, where risk lives, and how to address that risk with UVC as part of your total program. Our UVC platform addresses pathogens that are spread on surfaces. And so we're giving examples here of those types of pathogens like C. diff and MRSA, where our ARC mobile disinfection tower and Vive far UV installed device work well to combat surface pathogens and inactivate those. Also, UVC works for airborne illnesses. So this is where you're breathing infected air while you're in a shared space with someone else. A dining room in a senior care facility is a great example of that. And all of our UVC devices work to combat that. So you could use our ARC mobile disinfection tower to disinfect, between sittings in a room, or autonomous UVC like the beam upper air device, which disinfects air in real time as people would be dining together. And I'm going to talk a little bit about those use cases. Let's talk about the ARC first. So the ARC mobile tower we recommend for every senior care facility because it's mobile and you can use it across your entire facility for any room type. It disinfects 1,000 square feet within 7 minutes. So if you have a smaller space like a shared bathroom, sometimes there are bathrooms between rooms where 2 residents or 4 residents may share the same bathroom. The square footage of that room would be much less. So the number of minutes you'd have to run the arc might be 3 minutes or less to disinfect that small room. But what the arc will do is kill all surface and airborne pathogens in that room in a short amount of time. How it works for your staff is you wheel the device into the room, you turn it on, you leave the room, and it's set on a timer, and it will start to work after some period of time after you've left the room. It disinfects in a few minutes, it's done, and then you come and you roll that device into the next room. Our devices are safe in that if any human being comes too close to that device, it will automatically turn off. It has a presence detector, so it only will operate in an unoccupied room. This is great for incident response as well. We just recently had a customer who had an outbreak in their hospital, and they used the arc to contain that outbreak. It's really good for that type of situation, and also routine disinfection. We also offer upper room devices, and one of them is the Vive, which uses a different type of UV technology called far UV. It distributes a cone of UVC, which disinfects surfaces and air, and it operates autonomously and in rooms that are occupied. So it's fully human safe for skin and eyes. 30,000 hours spent in a room with a Vive is equivalent to 10 minutes in the sun. It has been, lab tested and validated as being human safe. But what it does is it disinfects the air and surfaces, and we recommend it for your highest risk spaces. So really good example of this in a senior care facility would be any of your shared bathrooms. Another great example would be your busy nurses stations, where you have a lot of people coming and going and in close proximity to each other. That cone of light provides safety in transmitting airborne and surface-based illnesses in those situations. And then the third device that we're recommending for the senior care facilities specifically is Beam, which is our upper air UVC device. What it does is it establishes a zone of UVC at the, near ceiling height of each room. This is a great solution for your common areas where people congregate together, like your dining spaces, recreation rooms, your lobby where people are coming and going, staff, any medical staff that's coming in, and visitors coming and going. It operates continuously, autonomously. It has a presence detector, so when anyone enters a room, the beam turns on. When people have left the room, it continues to disinfect for 20 minutes following that time. So the room is constantly disinfected, and it inactivates pathogens in the air. So as I'm sitting in a dining room with you, I breathe out hot air. My breath instantly rises because it's warm. It goes up into the disinfection zone. Pathogens are inactivated and cycles back down. So actually the air in between us is disinfected in real time. This is a germicidal UV, and it is the UV that's recommended for the rooms that require the highest effective air changes per hour, where the most risk exists. And so we're recommending this for your common areas and shared spaces. It also covers a very large area, and you can install multiple beams in a room that is significantly large to have the highest efficacy. The other thing I just wanted to mention, which I had mentioned earlier, is all of our devices are data connected. So they send data to our software platform, which is called R0 Connect, and allows you to see the metrics that matter to you in ensuring safety of your spaces and decreasing risk. So you can see adherence, for example, to a janitorial workflow. You could see, by room type, by wing, or by hallway, or by entire facility or a grouping of facilities, the risk score, and then the routine adherence to understand, what is disinfected, what isn't, and where you should move, people and assets to create the optimal environment of health. I wanted to share quickly just some of the healthcare industry customers and partners that we work with. We are, two customers for reference in the senior care vertical are Trilogy Health Services as well as Mission Point. They've both deployed a variety of our devices to create a healthy indoor environment for their staff and residents, and we're happy to provide those references as needed. We are deployed at scale across other industries as well. We work with hospitals, which is material. We work with corporate, public sector. We have a number of partners. One of our partners is the Mayo Clinic. So, really proud of the work that we're doing to bring this innovative technology to the communities that need it the most. And so that's what we're hoping to do with you with the Tennessee grant. With that, I'm just going to check to see if there are any questions or messages. What we will do following this webinar is we'll send out the link to this content for anyone who participated in the webinar. We also have a series of resources we can share on our products, on efficacy, as well as links to the resources that I included in an earlier slide from the state of Tennessee and how you can actually pursue the application. Or if you seek our help, we are happy to help you move forward with that application process. My contact information is, my email is kristen.alexander@r0.com. And it's, we'll send that following this. And I can be reached at any time today to help. We just have a short window. There's only 2 days left to get in the application, and we'll support you in doing that. Please reach out right away if you would like help, and we'll certainly walk you through that process. Really appreciate your time today and hope you can, deploy a program that ensures disinfection and a healthy indoor environment for your residents and staff. Thanks so much. Hi, everyone. I think there was a question about Candida auris, and the answer is yes. Our devices work to inactivate that fungus. So actually, we just had a hospital who had an outbreak of that. It's going around in hospitals and senior care facilities, and UVC is effective at inactivating Candida auris. We have a study about that. We have a blog post on our website. We also have a complete study. It's a peer-reviewed research paper for that, and we are happy to send that to you as well as a follow-up. Are there any other questions now while I'm here? I think that was Clayton had that question, so hopefully I've answered that question. Any other questions that folks have? I'll wait a few minutes to give people a chance to ask. I don't think I see any other questions, but just for the folks that are watching, my colleague Danielle put in the chat the blog post. It's what is Candida auris from our website. So that's available. And also she added a link to our white paper on that specific fungus and UVC's efficacy and R0's device efficacy in combating that. So those are resources that you can grab from the chat. We'll also, when we follow up with resources from this webinar, I'll include those links specifically so you have access to those as well. Any other questions? I think I'll give it maybe 2 more minutes and then we'll let it go. Yes, there's a question in the chat. Will a recording of this webinar be sent to us? If so, where? When you registered for this webinar, you would have included your email address as part of your registration. So we will take all the email addresses that registered for this webinar, and I'll send an email to you with to that email address with all of the follow-ups. And if there's something specifically you'd like, you can always email me personally that I didn't include. My email is also, I think Danielle put it in the chat. It is Kristen, Kristen .alexander@r0.com. And obviously this is a high priority for me today. We're trying to help as many facilities as we can, and I'll respond to you as soon as I hear from you. Any other questions? Thank you so much. Really appreciate everyone joining. And again, our goal is to be as helpful as possible. We're happy to send links. We will do all of that, but if you have specific questions, respond to those, point you to resources, try to help you get in the right direction. Our goal is to be, a partner to you, now and for the long term, as we really are invested in providing healthy environments for our senior population. Thanks so much.